We're going to be putting out some of our mosquito traps. Those will sit out for 24 hours and it'll allow us to see what kind of mosquito species we have, and we'll send those off for testing. This is also an area where we have one of our stormwater ponds, so we're going to dip for some mosquitoes here and see if we can find any larvae in the water. We're out today putting mosquito traps. We have 13 trap sites throughout the city, and we have 3 traps at each site. We're hoping to see what we can get. We set out the traps because we're looking at the number of mosquitoes in every trap as well as the species within that trap, and we can detect the virus within certain species. We know that some mosquitoes are more capable of transmitting diseases than others, so we're trying to determine the number of mosquitoes that are present and then looking at the disease within them and trying to figure out the potential for those mosquitoes to carry a disease over to people. We're also looking to see the numbers to determine if our control efforts are lowering the population and to see what kind of impacts the environment and the weather are having. We want to see that our control efforts are effective, and our control efforts are going to be separate from our trapping, where we are looking for larval habitats where mosquitoes live in the juvenile stage in the water, and we can apply a chemical to that water to reduce the mosquito population. We do a number of larviciding activities, especially in our catch basins that are located throughout the city, and that's where we have the most positive effect on the numbers. And then when we're looking at our mosquito traps, we're trying to determine if the control efforts, if we're actually seeing a result and we're actually lowering the population. People can have a much bigger impact on the mosquito population than they think just by emptying standing water around their home. Mosquito control and disease prevention really is a numbers game, where the less number of mosquitoes there are, the less potential for disease transmission there is.